Greetings from the World Health Organization in Geneva. And first of all, I'd like to congratulate the Alliance for achieving the milestone of 10 years. So, happy birthday. And I think it's a wonderful 10th birthday for this baby that was born between collaboration between the Department of Biotechnology, the Government of India, and the Wellcome Trust. And what it's achieved in these 10 years is certainly quite remarkable. So I would really like to pay tribute to all the people who conceptualized this alliance and have nurtured it through its childhood. Having been head of the ICMR and having been closely involved with both the Department of Biotechnology and the Alliance, I know from first-hand experience the quality of the fellows as well as the very high-quality scientific outputs that have come from the support that the Alliance has provided. It's also provided lots of opportunities for these young people to launch a career in India or to nurture people who were mid-career, and also opportunities to engage and interact with the best scientists from all over the world. We know that science can only grow and thrive when there is good interactions and good collaboration between people regardless of national boundaries. And I think the opportunities these fellows have had to really be part of this global community have been one of the key factors in its success. So thank you very much for inviting me to say a few words, even though it's by video and not in person. I just want to talk about what research, particularly in the area of health, can do to tackle the problems that are plaguing India and, in fact, any other country in the world today. We urgently need to accelerate support for the generation of meaningful and relevant research that will inform policy changes. In the biomedical research arena, India has already demonstrated its ability to develop locally relevant innovations, successfully achieving globally leading timelines for diagnostics, therapeutics, and vaccine development. WHO pre-qualification is the preeminent global quality assurance for medical and health products. And Indian manufactured health products have long been a key contributor to the pipeline of products, not only for India, but for the world. In several cases, WHO has looked to Indian manufacturers to supply high-quality products that have enabled access to those most in need, with the good examples being the meningococcal A conjugate vaccine for Africa, the pediatric dispersible artemisinin combination therapies for malaria. And these are just two of the many examples where WHO has confirmed a critical unmet public health need, and India has been able to meet that need, or Indian manufacturers have been able to meet that need through product development at scale. Increasingly, the major limiting factor is the prioritization of the work that's done by innovators and product developers to identify those products which are likely to have the greatest impact and which are feasible for scaling and sustainability. WHO's 13th General Program of Work has made a commitment to advance public health in three key areas. The first is achieving universal health coverage for at least 1 billion more people. The second is healthier populations, and this is very much in line with the ambitious 2030 targets of the Sustainable Development Goals. And the third is making people safer through protection against health emergencies and outbreaks. Now, we really look forward to India playing a leadership role in research and innovation that will accelerate both India's and the world's progress in these three critical areas. I will come back to the India-led initiative on research for universal health coverage later. But first, let me turn to the Nipah example. The work of national Indian authorities with the Kerala state with ICMR, with DBT, in partnership with WHO and others to control the recent Nipah virus outbreak demonstrated the possibility of rapid action, but it also demonstrated the major risks that India faces from emerging infectious diseases in the future. WHO's R&D blueprint is working to support Indian health authorities in their research preparedness efforts. It is critical that a broad research agenda is now set and followed to ensure that we have a better understanding of the transmission of Nipah as well as other related zoonotic infections, understand risk behaviors, as well as improve critical surveillance and diagnostic capacities, and evaluate promising therapeutics and vaccines. With Zika's ongoing emergence, India has a critical time window to strengthen its emerging infectious disease research capacity if the country is to detect and control outbreaks rapidly in the future. If WHO has learnt one lesson from previous outbreaks, it is that readiness is entirely dependent on maintaining the sense of urgency in the inter-epidemic period. So I'd like to encourage all of you not to hesitate to contact WHO for support in this area of work. The R&D Blueprint team is ready to provide any support needed, working with our global partners including the Wellcome Trust, DFID, the Bill and Melinda Gates Foundation, and many others. However, basic and biomedical research is not enough. We need research on implementation and the effectiveness of services in order to optimize the delivery of diagnostic and care services. Further, improving the health and well-being of people also needs better nutrition services, better living and working conditions, and cleaner air. So collaboration across multiple sectors, especially multiple social sectors, is critical as we move towards the Sustainable Development Goals. We need health systems research to evaluate innovations that are done in multi-sectoral collaboration and analyze how these innovations can be scaled up. Moreover, we need to remove financial barriers that prevent people from accessing better health. We must tackle the questions of equity and ethics, for which economic and policy analysis are important. So more research is clearly needed, but more research must not remain an end in and of itself. Increasing demand for and use of research by decision makers in low and middle income countries is also key. There's a clear gap between the generation and the utilization of research because the research doesn't often respond to the questions that decision makers want answered, and it's not always made available in a way that's useful to them. Underlying this is the problem of where the research is being done. Very often it's with lead researchers and authors in other countries, especially the global north, removed from the realities and contexts of the countries where it is expected to be used. There's also an issue of how the research is conceived. It rarely considers the views of decision makers and people who are likely to use the findings. So we need some fundamental shifts in the way that research is taught, generated, and used. We must work to generate the conditions that better support interdisciplinary research. When I started my research career over 25 years ago, interdisciplinary fields such as health systems research did not exist as a career option. The learning streams for science, the arts, and commerce were distinct, and students chose in secondary school to go down a particular path to the exclusion of others. The social sciences were very peripheral to our medical training, and this pattern continued throughout the educational experience and also defined how research was taught, practiced, and organized. I've observed that the situation in India is not very different now, and the same is true in many other places, especially other low and middle income countries. So research teaching, funding, and administration need to become more interdisciplinary. the social sciences must come together with the biomedical sciences, which in practice needs a lot of dialogue, patience, and mutual understanding. While the natural sciences bring the virtues of precision, scientific temper, and skepticism, which is very important, but on the other hand, social sciences help us to understand context and complexity and are a humanizing influence on research, which is important in the context of our push for people centered health systems. Being interdisciplinary also means that we need to look beyond traditional hierarchies of evidence towards a more strategic approach. Instead of asking what is the superior form of evidence, we should ask what methodology is most appropriate for a given question and be open to apply different methods that tackle different needs of the health system. This also does not mean that we should disregard basic research in both social and natural sciences. Basic research it's the root that nourishes and grows a scientific discipline, whereas interdisciplinary fields like health policy and systems research are the fruit that can be used for real world change. Creating opportunities for and a culture of interdisciplinary research is not easy and requires educators and funders to create the necessary conditions. Research councils, education boards, and research funders must do more to support interdisciplinary training and programs that tackle real world problems. We need countries like India to step up and show even more global leadership in health research. Currently, it's still the northern funders, PIs, and authors who are dominant in most forms of health research, though this is changing, has changed over the last 5 to 10 years. It's critical that research leadership needs to come from being much closer to the issues that are being researched. Governments must be empowered to act on their health research strategies and priorities in a way that best serves their people. Some of you may know that WHO is changing the way we work to focus on delivery at country level as part of our 13th General Program of Work. One of our innovations as a part of this transformation process is the country-led initiative on research for universal health coverage. In this model, we are discussing with countries what research they need to tackle to move towards their UHC goals. And all research groups and departments within WHO will respond in coordination to the needs expressed by countries for technical support and capacity building to take forward research on their priority areas. Ultimately, the impetus to address the skew in the global arena of health research must come from countries themselves. The scientific community must also make a point of working more closely with health systems in your own districts and states and at the national level. The leaders of many country health systems, and until recently I was part of one, are too focused on day-to-day tasks of planning and implementation. As scientific leaders, we can try our utmost to engage them, that is the policymakers and the planners, to embed research and learning into all aspects of their decisions. Encourage them to see it as an investment, even if it seems to distract them from the urgent needs they deal with every day. I know that the Alliance has at its core a commitment to interdisciplinary research as well as a striving for perfection and for benchmarks, to attain the benchmarks in scientific excellence. And I think it will do well to expand its scope to promoting more interdisciplinary research, social science research, as well as research in the fields of public health, especially related to epidemiology and population data systems. Once again, I'd like to wish the Alliance a very happy birthday, 10th birthday, with best wishes to you all. And I hope that the journey of the next 10 years is going to be even more exciting and more productive. And as WHO, we are there to partner with you in any way in which we can be useful. Thank you very much.